Hello friends, welcome to our channel. Today we are discussing about very important disease that commonly affect the urban area peoples and city peoples called diabetes. This is our part first. In this we are discussing about what is diabetes and its type 1 diabetes type, and our part second contain type 2 diabetes and their signs and symptoms and precautions. Let's start our session with diabetes. What is diabetes? Diabetes having two types, diabetes mellitus and diabetes insipidus. In today's lecture we are discussing about diabetes mellitus. It is a group of disease characterized by high level of blood glucose resulting from a defect in insulin production and insulin action or both. Diabetes is caused by the insufficient amount of insulin, or in our body there is a abnormal increase in the sugar level cause diabetes mellitus. The term diabetes mellitus describes the metabolic disorder of multiple etiological characteristics by chronic hyperglycemia, means increase in glucose production with disturbance of carbohydrate, fat and protein metabolism result from defect in insulin secretion and insulin action or both. Insulin is secreted by the exocrine gland called pancreas. Pancreas secrete in that islet of Langerhans secrete insulin. In that beta cells secrete insulin. The effect of diabetes mellitus include long-term damages, dysfunctioning, failure of various organs. This is the normal glucose in the blood, and excess glucose in the blood look like this. Insulin is the principal hormone that regulates uptake of glucose from blood into cell of the body. Means insulin have the function to store excess sugar in the blood in our body, especially in liver, adipose tissue and muscles. Except smooth muscles in which insulin act via IGF-1, insulin like growth factor 1. Diabetes pathophysiology. Therefore, deficiency of insulin or the insensitivity of the receptor play a central role in all form of diabetes. Pathophysiology includes the body obtain glucose from three main places: intestinal absorption of food through microvilli, and the breakdown of glycogen from the storage form of glucose found in the liver. Glycogen converted into glucose by glucagon. Gluconeogenesis, the generation of glucose from non-carbohydrate part like protein, fat, substrates in the body. Insulin play a critical role in balancing glucose level in the body. That's why the person suffering from chronic or very dangerous diabetes doctor give though the injection of insulin for the control of excess sugar level in the body. It can inhibit the breakdown of glycogen or the process of gluconeogenesis. It can stimulate the transport of glucose into fat and muscle cells. That's why insulin is very important in our body. It can stimulate the storage of glucose in the form of glycogen. Insulin is released into the blood by the beta cell, as we discussed previously, found in the islet of Langerhans in the pancreas. It is exocrine gland which secrete their secretion via duct. In a response to rising level of blood glucose, typically after eating, lower glucose level result in a decreased insulin release from the beta cells and result in a breakdown of glycogen to glucose for the body. This process is mainly controlled by the hormone glucagon, which act in an opposite manner to insulin. If the amount of insulin available is insufficient, if cell respond poorly to the effect of insulin, if the insulin itself is defective, then glucose will not be absorbed properly by the body cells. Net effect is a persistent high level of blood glucose, poor protein synthesis, breakdown of fat storage. called as acidosis. Diabetes is a chronic lifelong disease marked by the high level of sugar in the blood. The type of diabetes, there are two types of diabetes. One is type 1 diabetes and other is type 2 diabetes. In today's lecture, we are discussing about type 1 diabetes. In the next lecture, we are discussing about type 2 diabetes. Type 1 diabetes is a chronic, lifelong disease that occurs when the pancreas does not produce enough insulin to properly control the blood sugar level. Means there is a dysfunctioning of pancreas and islets of Langerhans or beta cells because they do not secrete insulin for the control of high sugar level in the blood that cause type 1 diabetes. What causes type 1 diabetes? The body's own immune system attack and destroy beta cell in the pancreas that are responsible for creating a hormone insulin. Type 1 diabetes, formerly known as insulin dependent diabetes mellitus IDDM. This is very important, that insulin dependent diabetes mellitus, the destruction of beta cell caused due to the early production of cow milks and cereals, intake of medicinal drug during pregnancy, indoor smoking of family members, destruction of beta cells of the pancreas result in a little or no insulin production that's cause high glucose level in the blood. That sugar level can cause many other disorders. They require daily insulin admin. It may occur at any age, usually appear below age 15. It's occur commonly in the children's. This is for today's diabetes lectures. Thank you for watching this lecture. In our next session, we are discussing about type 2 diabetes, gestational diabetes, and signs and symptoms of diabetes and their precautions to be take. Thank you for watching. Please like, share and subscribe. Thank you.